Today we're going to speak about the topic of, in business, we always live by the adage that the customer is always right. But in plastic surgery, is the patient always right? Greg?
Maybe not. We certainly would listen to what they want to do, and hopefully everybody's on the same page, and if they're realistic, then that would be fine.
All right, Stafford, what do you think?
Well, we want to assume the patient is always right, and we want to help the patient make the right decision, but we know so much more than they do. We do this every day, and we know the fine points that can make it a better operation or a better outcome. So we have to educate them so they come to the same answer that we're looking for and that they're requesting. So I think it's a little more complicated than they're right. In the end, the outcome will be right, and they will think they're right. And that's what we want to do. We want to make sure that we have a melding of our expectations and their expectations.
All right, so let me give you this scenario. 23-year-old female comes in, her best friend in the entire world just had a breast augmentation. She had a 310cc anatomic implant. That's what she wants.
I would certainly find out why they really want that implant, and of course educate them and examine them and make sure that that implant would fit. If the biggest problem I would have is if that implant's not going to fit their body. Okay, if it's just not going to fit from a dimension standpoint, we would have a big discussion about that. If it really fits their body and that's exactly what they want, fine. I've had patients say, no matter what, this is the biggest one I want or the smallest one I want. And as long as it'll fit from a dimension standpoint, I'd be okay with that.
So Craig, what you're saying is it's the preoperative discussion that leads you to that. So I think that's what you're mentioning as well.
So the bottom line is our objective is to satisfy patient expectations, to give him or her the result that they ultimately desired, and that's what makes them right. If you want more information, please go to theplasticsurgerychannel.com.